Good morning and welcome back to the channel. I hope that everybody is doing well. As you can see, I'm actually at work right now. I'm in the office. I just got here. I'm actually opening up the office today. I work a full day. I work 10 a to 10 p. So I am the first one in the office right now. And actually, I wanted to take you along today for a day in the life working at the urgent care. So many people have requested this video from me, and it's just hard, obviously, for various reasons to record while at work. One, I'm generally pretty busy and I have a hard time taking the time to pull out the camera and record. And two, obviously I have to maintain privacy with my patients and respect HIPAA. But today I'm going to do my best to take you along for the day and kind of just give you an idea of what to expect when working at the urgent care. So I just walked in and we actually already have 2 patients checking in. I can see what their chief complaints are now. There is a female here. She is here for nausea and vomiting. And then I have a younger gentleman in the 20s here for some upper respiratory symptoms. Both of them have stable vitals. So I'm going to go in and assess those patients and see what it is that we are going to do. But just for a general idea, we have COVID and flu testing here. We can do IV fluids. We can do a lot of basic lab work. We obviously have x-ray. We can do a lot of orthopedic stuff here. So I'm going to go in and see these patients, get them started, and then I'll try and keep you updated on how it's going throughout the day. All right. So I just went and saw those first 2 patients. The one lady that is here for the nausea vomiting, she's pretty sick. She's got diffuse abdominal tenderness. She's vomiting. So this morning, actually, the symptoms started. She said she started with diarrhea around 2 a.m. and then it proceeded to turn into both diarrhea and vomiting. She did take Imodium at home. The diarrhea has subsided, but she's still vomiting, very nauseous. So a few things that we're gonna do, and I don't always do like full workups like I am with this patient. Usually it's a little bit more straightforward, but with someone of her age and abdominal pain, nausea, vomiting, there's a lot more obviously that goes into seeing what's going on. So we are doing an EKG. I'm gonna give her some fluids, giving her 1 liter of normal saline, giving her 4 of Zofran IV, and we're doing some basic lab work as well. Also, we're testing her for COVID and flu. I kind of told her what the plan is. High on my differential is just some kind of virus. Of course, so an acute abdomen and cardiac stuff. I mean, all of these things we have to rule out. If everything comes back normal and she improves with the treatment, then I'll send her home with strict instructions on what to monitor for. I'm hoping to get her feeling better here and that she doesn't have to go to the hospital. But you know, that's always a possibility with these type of symptoms. I'm gonna wait and see what the EKG shows, get her some fluids, get her hopefully feeling a little better, and figure out what the plan of action is from there, whether she gets to go home or if she needs to go to the hospital. To see my flow usually is seeing 2 patients and then coming back to charting. So I also saw the gentleman here for the upper respiratory symptoms. His are very mild. It started 2 days ago with a sore throat, nasal congestion. It's starting to settle a little bit into chest congestion. He has a little bit of cough, denies fever, chest pain, shortness of breath, nausea, vomiting, diarrhea, otherwise a healthy young guy. So we are COVID flu swabbing him, and we'll just go ahead and go from there. Nothing seems bacterial. I don't anticipate having to do any kind of antibiotics for him. I believe it's just some sort of viral infection. He is complaining of severe throat pain, and when I looked into his throat, he does have tonsillitis, so there is some inflammation there of the tonsils. I don't see any white patches or any exudate or anything like that. I do think that he would probably feel some relief from a dose of Decadron just to reduce that swelling back there. You can tell it's very uncomfortable for him to swallow. So I probably will do that in his treatment plan. So while the MAs have this stuff going, while I've got some swabs pending, I'm going to do their charting. So I have to get in their diagnosis and plan of care before they can discharge home. I also will try and see if I can get some of their HPI done while they're getting their treatment going, and we'll go from there. So here I am charting away. This is a lot of what my job looks like. Charting on top of more charting. As you can see here, I moved offices and I decided to have lunch while I finished, you guessed it,
more charting. So like I kind of already touched on, before a patient can be discharged home, I need to have their diagnosis and plan of care completed in their chart. So this includes any medications that I might be prescribing, patient instructions and advice, any referrals if necessary, and then the patient's disposition. Additionally, any interpretations should be completed and charted before the patient's discharge as well. So this refers to things like x-rays and EKG interpretations. Other charting that's required before locking the patient's chart, though it does not have to be completed before the patient is discharged from the facility, includes, of course, the patient's HPI, review of systems, exam, and then any procedural charting that needs to be completed.
All right, so things are getting a little busy. We've got a couple other patients getting roomed. It sounds like generally it's a lot of upper respiratory stuff, a couple of orthopedic things as well. I really only have just a minute to kind of touch base with you guys and tell you what's going on because I have more patients checking in currently. So the lady, I'm trying to remember what I told you guys. I only told you about my first 2 patients and I'm now like 10 patients in. So the lady that I was telling you about with the nausea, vomiting, all of her labs came back completely normal and she did feel significantly better after the fluids and Zofran. So basically I just discharged her home with strict instructions that if she developed worsening symptoms, chest pain, shortness of breath, fever, diffuse abdominal pain that was not improving, obviously vomiting that she can't control, all of those things would warrant a trip to the hospital for further evaluation and a CAT scan of her abdomen. But I did send her home with some Zofran, and she seemed significantly better after getting here and verbalized understanding, if she needs to follow up with the ER. Also, she's going to follow up with her primary care this week. So I think she's going to be A-okay. The younger guy tested negative for COVID, flu, strep. I gave him a dose of Decadron. I did the 10 milligrams PO Decadron to help with that inflammation and swelling in his throat. And he went home as well. And then we had just a bunch of other patients come in. It's only been a couple hours, and I think I've seen 13 patients so far. I had a lady who had a mechanical trip and fall. So she's complaining of elbow and shoulder pain. And it looks like she has kind of an obvious deformity of her elbow. She is neurovascular-wise intact. She can move all of her fingers. She can feel all of her fingers. Her sensation is intact. Obviously, her range of motion is restricted due to pain and swelling. I really don't want her moving it anyway because it looks like she definitely fractured something, and I don't want anything to be exacerbated or worsened by moving the joint. So right now I'm getting an x-ray. I do anticipate that she's going to have a fracture in the elbow area somewhere there. So we're going to kind of wait and see what the x-ray shows.
So as you can see here from these images, the patient has displaced fractures of both the proximal ulna and the proximal radius. So definitely not the outcome that this patient was expecting or hoping for. So we placed her in a sugar tongue splint and then also provided her with an arm sling for additional support. Because both the ulna and the radius were fractured, this is a more unstable injury and most likely will require surgical repair. Not pictured here are the additional x-rays of the shoulder. However, this was found to be intact.
We have orthopedic specialists here in the building, which definitely makes my life a lot easier because we have these people here and easily available to us. So they are currently making an appointment right now, and they should either be able to be seen today or tomorrow. Like I said, she's neurovascular-wise intact, which is obviously of extreme importance, and if that were not the case, then we would be sending her to the ER. So I'm closing up for the day. It's coming to the end of my shift right now. I just actually finished my charting. I wanted to make sure I got that done before I left here. It's almost 10 o'clock now, and we close at 10. We did end up getting really busy, and it was almost impossible for me to pick up my phone and record anything, to be expected. So we saw a lot of stomach viruses. That seems to have been the theme for today. But they're coming back at negative for COVID, negative for flu. I don't know if it's norovirus or what, but that seems to be predominantly what we saw today. Of course, I do Zofran for nausea, vomiting. That seems to be very helpful. Sometimes I will also do Bentyl for an antispasmodic if they're having really bad cramping with their diarrhea, and that kind of can help with the abdominal pain. Obviously, hydration status is always of concern when patients are having vomiting and diarrhea, and an easy way to check that, of course, is to do a urinalysis and look for ketones or protein in the urine. Also, you can just, based on clinical exam and what they're reporting, I will do IV fluids if I think it's going to benefit them. Of course, you have to ask the questions if they have, congestive heart failure or anything. We don't want to fluid overload anybody, but if it's appropriate with the patient, it's always nice to give them some fluids because they will leave feeling significantly better. It's not really recommended that you do, like Imodium or something to stop them from going to the bathroom, because if it's a viral infection, your body is trying to get rid of that. And so you don't want to stop them from going to the bathroom. So that is not recommended. But you can give them some stuff to make them more comfortable. And so that's pretty much what I've done all day. That's been a lot of it. We had a couple other orthopedic stuff, nothing even exciting. That being said, my charting is done. So that is always a perk. I get to go home and at least chill out. The problem is when I leave here at 10 p.m., it takes me a while to wind down. And so I'll probably be up now for a couple more hours watching something mindless on Netflix or something until I feel like I can fall asleep, which I know is bad practice. I know I should just go into bed and close my eyes. But I really feel like when I get home from work, I just need time to sit down and read or watch a show or something before I can just go straight to bed. Also, I'm hungry. And we do have drug reps that come here multiple times a week, and they do bring delicious food. They brought us Mediterranean today. I already had 2 mini chicken shawarmas. They were delicious, and I might sneak one out of here to take home for dinner too because they were that good. Mediterranean food is definitely one of my favorites. So that being said, I'm going to close out this video. Hopefully you found it interesting. I wanted to be able to talk to you guys more and show you more, but it's just so busy. It's hard. I will do this again though if you like this kind of thing. I'll do more of the day in the life at the urgent care. So hopefully you guys enjoy it. I wish you nothing but the best. Don't forget to like the video, subscribe to the channel, and I will talk to you guys very soon.